In Minnesota overall, we look like an incredibly healthy state. We consistently rank in the top 10 healthiest states, top 5 healthiest states in the nation. But when you start to pull back the layers, what we see is that people of color, and particularly African American and American Indian people, are suffering poorer health outcomes. Structural racism is a fundamental cause of health inequities. We know we have these social determinants, right? So things like education, our housing, the quality of the jobs we have access to, the neighborhoods we're able to live in, all dictate health outcomes. And a lot of the reasons that people live in certain neighborhoods or only have access to neighborhoods that perhaps are unsafe is because of structural racism.
Systemic racism isn't about individuals, it's about these larger systems. And there can be really great people within these systems, but if the systems themselves were designed to only serve and promote the wellness and health of one particular demographic, which in our country is white men, well, if that system is inherently biased, increased contact with that system doesn't yield a different result. What we're talking about are people's lives, and people's lives at their most precious and vulnerable time. I mean, there's nothing more cherished than a child coming into a family. And so what that looked like was people being ignored, being treated poorly.
It was a very traumatizing experience for a lot of people that I knew, or just feeling like they were rushed, or feeling like they had unnecessary complications, or feeling like they weren't listened to.
Having bad outcomes, losing babies.
African American and American Indian babies are twice as likely to die in their first year of life. We also know nationally that maternal mortality is a huge issue right now.
Hearing about mothers who had actually not made it through the process. And that's kind of shocking to think of in this day and age.
When you start to look at things by race, we see that Black women are 3 to 4 times more likely to experience maternal mortality.
I saw the deep divestment that had taken place on the North Side, as well as the issues of systemic racism.
Racial inequities are happening in communities that have had less investment, right? So when we think about structural racism and we think about neighborhood context and, redlining and things like that, and we look at the Camden neighborhood in North Minneapolis, it's a community that has not had the benefit of being invested in the ways that we need for health and well-being.
I saw the impact that disparities were having on my own community. I always knew I wanted to put a birth center in North to both create an investment in the community as well as to create a safe space for birthing families in the community.
Roots Community Birth Center is a freestanding birth center located in the Camden neighborhood in North Minneapolis.
I started Roots so that I could provide care in the community, by the community, and for the community.
Her goal was really to invest in a community where we see some of the worst outcomes in birth and maternal health in our state.
Wanting to bring community care back into the community, which is kind of an old-fashioned idea. It's actually not a new idea.
And I found so much empowerment as a mother, as a woman, as a person. It gave me so much more comfort and confidence.
For the past 3 years, we've been working to understand what Rebecca calls a culturally centered model of care.
You have people who are accountable to community, who see people for who and what they are and their full richness as they walk through a door. And that, amazingly enough, that incredibly low-tech thing actually does mitigate some of these things. What are usually described in the literature as their risk factors become their assets. This is what's working for someone. Their culture is what keeps them well, what keeps them whole.
To be able to have, other women of color there with me, I felt very understood in a way that I never thought that I really would be and hadn't really considered was even possible.
When we work with Rachel around this research, she's really taken that academic perspective to describe that value, taking the words of the people who've experienced our care themselves and turning that into usable data.
My role as a researcher and public health professional is to bring that empirical evidence and that data to light and really help people understand where we need to be focusing our time, our energy, and our efforts. Public health requires a social justice lens, because if our goal as public health professionals is to ensure that everyone has an opportunity to be healthy and to have a healthy life, we have to address inequity. And at the heart of inequity is social injustice.